Introduction. Joint fusion or arthrodesis is a surgical procedure to overcome painful joint motion and correct joint deformities. The procedure involves removal of the damaged bony ends of the joint, followed by fusion of the two bones using internal fixation devices such as metal screws to hold the bones together so that the bones can eventually fuse. Joint fusion surgery is mainly employed for the treatment of conditions such as arthritis. The procedure can be employed for the treatment of joint deformities in the spine, ankle, wrists, fingers, toes, feet, and thumbs. As the joint fusion surgery fuses the bones and prevents motion in that joint, the surgery is best suited for treating regions of the body that can still be utilized without complete range of motion. The main objective of joint fusion surgery is to help relieve joint pain and achieve joint stability by surgically eliminating the joint. Disease overview. Arthritis is a general term that covers numerous conditions in which the joint surfaces wear out. Joint surfaces are covered by a smooth articular surface made of cartilage that allows pain-free movement in the joint. This surface can wear out for several reasons. When the articular cartilage wears out, the bone ends rub on one another, causing pain, swelling, stiffness, and interference with joint motion. Indications. Joint fusion surgery is usually recommended as a last option for the treatment of severe end-stage arthritis that has not responded to conservative treatment measures such as medications or injections. The other indications include severe joint trauma or fractures, joint infections, joint instability, joint destruction due to tumors, severe joint pain affecting daily routines. Preparation. Pre-operative preparation for joint fusion surgery may involve the following: a thorough history and physical examination, routine blood work and imaging, refraining from blood thinners, aspirin, or NSAIDs, informing your doctor of any allergies to medications, anesthesia, or latex, refraining from solids or liquids at least 8 hours prior to surgery, arranging for someone to drive you home following surgery, signing a consent form after the risks and benefits of the surgery have been explained. Procedure. The surgery is performed under regional or general anesthesia, and antibiotics may be administered to prevent infection. A cut is made over the affected joint, and the soft tissues and nerves are carefully moved aside to expose the damaged joint. The damaged articular cartilage on the end of the bones is removed, and the bones are realigned. Your surgeon may add bone grafts to fill the gaps between the joints if necessary. The bone graft may be obtained from another part of your body, autograft, or donor tissue, or a synthetically manufactured tissue, allograft, may be used. Metal pins or screws are then used to keep the bones in place while they heal. This metal hardware is often left in place permanently, even after the joint heals. The tissue layers and incisions are then sewn back together, and a splint or cast is placed for protection as the bones heal and fuse together. Post-operative care. You will be instructed on how long you need to remain in the cast or splint, depending on the joint being treated. In general, post-operative care and recovery will involve the following steps. Prescription pain medications are provided to control pain. Application of ice bags over a towel to the surgical area can also help reduce post-operative pain and swelling. Instructions on diet, bathing, and surgical site care are given. You should avoid strenuous activities or lifting heavy weights for a specified duration. Assistive devices such as a cane or walker are used to reduce stress on the treatment area and promote healing. A physical therapy regimen to help strengthen the joints and optimize their function is prescribed. A periodic follow-up appointment will be scheduled to monitor your progress. Risks and complications. Joint fusion surgery is a relatively safe procedure. However, as with any surgery, Some risks and complications may occur, such as infection, persistent pain, damage to nerves and vessels, failure to fuse, malunion, broken hardware, graft migration. Summary: joint fusion surgery is a procedure performed for patients with persistent symptoms of joint pain and disability that have not responded to other treatment methods. Most patients have remarkable improvement from their painful condition with improved joint stability and prevention of further joint deterioration.